So today in this video we'll be covering everything about PLAB. If you are a doctor, you have finished your MBBS, when you can apply for the PLAB examinations. So PLAB is the UK license exam which you can give to practice in the United Kingdom, which you can give it after finishing your MBBS even when you are in your internship years. First you need for this exam is English exam, that is IELTS or OET. You need to have a particular score in IELTS and OET if you are giving. For OET you need B in all listening, reading, writing, speaking. For IELTS you need 7 in each module, that is listening, reading, writing, speaking, and overall 7.5. If this is the score you get, you can book your PLAB-1 exam. Now PLAB-1 is a MCQ exam which is 180 multiple choice questions. You pass this exam depending upon the score on that particular day. So in 3 hours 180 questions. So almost you get a minute to answer a question. It's a MCQ exam. You select the best option, and once you clear this exam you get to book your PLAB-2 exam. So PLAB-2 is a OSCE exam. In this exam you will be going to the General Medical Council Center. This exam is done only in the UK at Manchester, whereas your English and PLAB-1 exam you can give anywhere in the world. There are a lot of centers for IELTS or OET or PLAB-1, whereas PLAB-2 you have to come to the UK. You have to get your visa for PLAB-2, that is visit visa, come to the UK, go to the General Medical Council office. There is the street office, and the other one is the square office, Hardman Square or street they say, where you give your this 3 hours duration exam, that is PLAB-2 exam. There are 18 stations, out of which 16 are clinical scenario, whereas 2 stations are just rest stations. In the clinical scenario you have a complete, you know a case, a actor acting like a patient, an examiner, a doctor who is evaluating you, how you are going to talk to this patient, take the clinical details, history, and manage this patient. So this is all about your clinical knowledge and interpersonal skills with the patient. So this is about PLAB-2. Once you pass your PLAB-2 exam, you apply for General Medical Council registration. This is GMC license, which is required for all the doctors to practice in the United Kingdom. Now after your GMC license you apply for your EPIC verification. You can even apply it in the beginning, very beginning. Your school, your medical school should be in the list of WHO, list of world medical schools. You get EPIC verification done, which is an online process. They verify with your university and send the details directly to General Medical Council. Now you apply for the jobs. This is the time you should apply for the jobs. You apply through online. There are different portals available like Track Jobs, NHS Jobs, BMJ Careers. So a lot of these options where you make your online CV, you put your personal details, your qualifications, your educational details, your clinical skills, the procedures, etc. You could do any training courses, any relevant teaching training experience, research experience, clinical audit experience, quality improvement projects, etc. What you have done, you include in this CV, and then you give some supporting information, that is a cover letter also, to make the interviewer understand what kind of experience you have for this particular post. So it is very important you prepare first about the post, the job descriptions given in the post, instead of just copy pasting, which is it is not going to help you out, and you may not get a lot of interviews. So it's very important that you read the job description and apply accordingly. Now in interview it is very important that you prepare thoroughly about the common clinical scenarios and the approach. You should rehearse about like how you present your CV, start from the relevant clinical experiences you have for this particular post, and how you can fit into this particular post advertised, and why they should select you. At the end, most of the candidate miss asking, when they are asking, the examiners are asking you in the interview, the panel is asking you, do you have any questions, and you just say thank you. No, you can ask questions here about different career pathways available, how supportive is the department, what kind of on call, etc. would be there, any clinical audit teaching opportunities there, any quality improvement project, etc. opportunity there, which could help you to build up your CV. And these questions you should always ask at the end when they give you this opportunity to ask questions. And then comes finally you apply for the visa. The NHS trust give you a cost certificate of sponsorship, and you go to the United Kingdom, with tier 2 visa known as skilled visa or health and care visa. And then you go there, you collect your BRP card, which is usually available at any post office or the address you have selected while applying for the visa. And according to that, now you report to your trust, and they will do your occupational health test, etc. if you require any vaccination, any testing, etc. And then you straight away start your job as the doctor in the UK. If you have any questions, any queries, you can reach out to us. The detailed numbers and emails of DAMS, Delhi Academy of Medical Sciences, is shown here in the description, and we would be very happy to help you at every stage of your UK application, so that we are doing complete hand holding for you, and you don't feel anywhere anxious about anything. Any detail you want to ask us, we are available to help you. We have a detailed PLAB-1 and PLAB-2 course available on the eMedicoz app of Delhi Academy of Medical Sciences, that is DAMS eMedicoz, which is available online. You could do this course. You can practice in detail all about the PLAB-2 also, which is also available in our Delhi center, and we'll try to help you out to pass your exam, build up a very good CV, prepare for interview well, and get your dream job in the UK. Thank you.